Hello and welcome to another episode of Purvis Versus. My name is Eric Purvis. I'm a massage therapist, a course creator, a continuing education provider, a curriculum advisor, and advocate for evidence-based massage therapy. In this episode, Nadine Hawyrluk joins me again for a discussion on the importance of having an evidence-based practice, and we also spend some time clearing up some common misunderstandings about evidence-based practice and what this means for the massage therapist. We also will go through the former CMTBC's resources for appraising evidence and explain why this is so important when choosing continuing education courses. If you enjoy listening to my podcast, please consider supporting it by making a donation. And you can do this by visiting buymeacoffee.com/helloob. Purvis Versus is also available on YouTube, so please check us out there and subscribe. Thanks so much for being here, and I hope you enjoy this episode. Hello and welcome to another episode of Purvis Versus. I'm excited to have Nadine back. Nadine was on, so far, the most popular episode we've ever had, where we talked about the new evidence-based practice standard for massage therapists in BC. And today we're going to talk more about the standards of practice and resources page, which the CMTBC had put out, and talk about the requirements. And our focus today is going to be on learning activities and how an RMT is supposed to engage in these learning activities consistent with this new evidence-based practice standard. We think this is super relevant because our learning plans are supposed to be evidence-based, and there's certain criteria they're supposed to follow. And if they don't, then we're actually not supposed to be using those in our learning plan. So we're going to have, I'm sure, a very interesting discussion today about what this might look like for potential learners. So thanks for being here, Nadine.
Yeah, thanks for having me. I'm excited to dive into this.
Let's just quickly talk about, I'm just going to review, for those that maybe didn't listen to the last episode, just the requirements. I'm not going to read the whole thing, but there's basically 4 requirements set out for evidence-based practice standards for massage therapists. Now, number 1 is an RMT is supposed to incorporate a patient-centered and evidence-based practice approach in massage therapy. And then they just, we're not going to read through every single line. Number 2 is an RMT incorporates evidence-based practice approach to support clinical decision-making when determining appropriate treatment plans. An RMT takes reasonable steps to maintain or remain up to date on research evidence to support an evidence-based practice. And number 4, this is going to be our focus today, an RMT engages in learning activities that A, are informed by research evidence, B, present information within RMT's scope of practice, and C, are taught by an instructor or presenter who holds appropriate knowledge and expertise to instruct RMTs in the context of a regulated health profession. I like that. Yeah. I don't know if this is what's going to be happening right now, though. What are your thoughts, Nadine?
I love how directed it is. I think it really lays out a great guide for everyone. But yeah, I think there's going to be a transition there for people because it is so new. It's like, what does this mean? Do we have the skills to do these things? So I think you're right. I think it might take a bit of time.
When we look at this, the thing that's so interesting too is now what we see evidence-based as being a term that's everyone using now, because that's what you're supposed to be using, right. And that's what we're supposed to be taking. And it's important for us to understand that evidence-based could be a marketing ploy used to try to trick people or try to convince people that what they're taking is supported by latest evidence. And I will admit for myself that I use or have been using the term evidence-based for a very long time in much of the content that I teach. But I never thought of using it as a marketing ploy. I wanted to always use it as, I'm not going to teach you nonsense.
Right.
Everything that's in this course is defensible by current best practices, current evidence which meets a certain criteria or a certain standard. For anyone listening, when you are looking to learn or build a learning plan, if you're in BC or if you're, I know we have listeners from all over the world, if you are looking to learn continuing education or quality assurance or professional development, whatever it's called where you live, it's really, really, really important to be critical of the evidence base. We'll put that in air quotes, even though no one can see because we're on a podcast. We'll put that in, because that evidence base, it's the minimum standard that we should have as a healthcare profession in terms of the information we're teaching each other, because the public deserves to receive current best evidence.
Yeah.
When we're looking at this in terms of learning activities, or continuing education courses, the other thing too is the point C, which talks about it's taught by an instructor or presenter who holds appropriate knowledge and expertise to instruct RMTs in the context of a regulated health profession. That's another one too, is how is an RMT supposed to know or decide who has the right expertise or knowledge?
Right. Right.
I like that it's there, but it's kind of vague. What are your thoughts on that?
Yeah, I think that could be a tricky one to parse out. And I think we could have a decent discussion on that about what are you looking for? Who do you want to see? What do you want to be able to find about that person? Are there certain credentials you want to see behind their name? Or is experience enough? Like what makes this person an authority on whatever topic that you're looking at?
This is one thing too, where I feel our profession really needs to step forward is just because you have 30 years of experience doesn't mean what you're teaching is valid or in terms of the science or narratives or explanations behind it.
Yeah. Yeah.
And this is a big problem that we see in the massage therapy schools, a lot of them.
Hmm.
I was recently at presenting at a school to some graduating students. And one of the biggest pieces of feedback I got from the students was that whenever they questioned their instructors during practical classes, it was this, well, I've been doing this for 30 years. I've been doing this for 20 years. I've been teaching this since the school was opened.
Yeah.
So they're using this appeal to their experience or their
Right.
authority as being, just don't question me.
Right. That somehow experience trumps evidence or knowledge in some way.
Yeah. And there has to be a blend.
Yeah.
I would agree.
Yeah.
I would think,
Yeah.
right? Would you agree with that?
Absolutely.
If you've just been out of school for 5 years and you're teaching a course and you don't have a lot of expertise, and maybe you don't have any extra education, does that make you an authority? Well, probably not, because you probably haven't built that clinical
Mhm.
expertise yet. You don't maybe necessarily have that extra education. But if you've been practicing for 30 years and you've got a massive amount of clinical experience, which we know is part of that evidence-based
Absolutely.
framework,
Yeah.
which is super, super important, but the knowledge of your clinical expertise, your understanding of mechanisms of effect, or what's actually happening when you're doing your treatments, that has to be based on
Mhm.
evidence. That has to be
Absolutely.
based on science.
Yeah.
And that's where I think things are often missing.
Yeah. Yeah. And I've heard a similar discussion happen among people looking for continuing education where someone was like, oh, well, I heard this teacher is fantastic. They've been teaching for a while, really engaging, super great. And then I said, yeah, but what are they teaching? It's like, do you go to an instructor just because they're super charismatic and exciting, or do you go because you're going to learn something really valuable? So I think we just need to be careful. And especially if I think we can think about this too, what you're mentioning about evidence is that we can think about other industries where there's like greenwashing or everything has eco stamped on it or whatever, right? And so you want to be careful. Is it really evidence based, or did they find some random citation and slap that on the bottom of their thing and it's not really related? So I think we just have to we have to go a little bit slower and think a little bit harder going forward.
I love your comment there about greenwashing. Same thing with like organics or organic.
Hmm. Yeah.
You can just be like a term that gets thrown around, but it might not. It's kind of meaningless.
Right.
And we have to be mindful of that too in massage therapy and in our evidence-based stuff, that just because it says it is doesn't mean that it is.
Yeah.
Just because you say something a million times doesn't mean that it is actually
Yeah.
evidence-based.
Yeah.
Big red flag for me, if when I'm looking or critiquing, I'm skeptical of everything. And those people that listen or know me, I don't believe much of anything. I don't even believe my own stuff some of the times because I'm skeptical of what I think I know, and which is fine. I'm the first to admit that. If you were going to take a course, so you say you want to learn something, you want to take, you name the course, you put in your favorite acronym or name or trademarked thing there, and you reach out to the instructors and say, hey, do you have evidence to support this? If they don't want to send it to you, or they say, we'll take the course and I'll tell you, and you'll learn,
Mm,
that's a big red flag, because that usually
right.
means you'll be challenged. If someone says to me, hey, I'm interested in your stuff, can you send me some content on what it is that your course is about? I will always send them, depending on what the course is about, I'll always send them a couple PDFs or some links to some of the things that kind of create some of the main topics. I'm not gonna send them everything, because a lot of the stuff that we have out there is, we've got hundreds or dozens and dozens of references. I'm not gonna send all of those, because you know
Right.
time consuming.
That's a lot.
It's a lot, but I would definitely send a few and say, if you have any questions, please reach out.
Yeah.
I never
Yeah.
have a problem with that at all, because as an instructor, this is what I do for 99% of my living now, is you have to be open and honest with the people that are coming to learn from you. You should be okay to be questioned.
Yeah. Yeah. And I think this is kind of, you can think of it like if you're in the store and you pick something off the shelf and you look at the ingredients list, you want to be choosy about what you are putting into your mind. You want to make sure that what is in the box is actually in the box. Um, and because it's a lot of time, energy, and potentially money that you're spending on putting these things into your mind, and you want to make sure it's good. Otherwise, you're really risking investing in maybe opinions, pseudoscience. That's a big risk.
I would guess that if you looked at every single course that was being taught to RMTs across Canada, I would think that you could probably count on both hands how many of them would actually be properly evidence-based
Mm,
and meet a good standard of critique, and you
hmm.
probably still have quite a few fingers left over.
Yeah. So there's room for growth.
There's a lot of room for growth. Now,
Yeah.
that's just from me I spend a lot of time looking and seeing what's out there. And and a lot of the stuff says it's evidence-based, but evidence-based for what? So you see a lot of stuff out there too, where people are talking about, oh, this is a course on the assessments of the lower leg or lower extremity or whatever. Say it's a course like that. I've seen stuff like that out there. And the person will people will go take that course, and there's lots of time spent on anatomy and joint kinematics and kinesiology, and all the muscles and ligaments and tendons. Those people get this kind of anatomy review. Well, that's evidence-based, because
Hmm.
there's like that's the science of how we move and where things are. But when I look at a course like that, I think, okay, what's the evidence for assessments in the lower extremity that are actually
Right.
valid, reliable, have good clinical utility? There's like none.
Hmm.
You have, I believe, Lockman for the knee is the only
Hmm.
one for ACL reps that actually has good evidence to support it if you're practiced and experienced. So you could have an entire course on treating and assessing the lower extremity, but maybe the only thing that's evidence-based about it is the actual anatomy.
Right.
And oftentimes those courses will be taught with this perspective of like, I'm changing tissue and I'm loading this and we're releasing that.
Hmm.
Where's the
Hmm.
evidence for that, other than just, oh, this I'm seeing a change, and so therefore my narrative
Right.
is valid,
Yeah.
which I think
And
gets us.
that kind of,
Go ahead. Sorry.
I was just going to say that kind of stalls our profession a little bit. And it just reinforces some of the false things we've learned already. So, how is that helping? How are we helping to improve the outcomes of patients?
When we see these types of courses and we see these types of, it's evidence-based, but it's really just rehashing a lot of the stuff we already learned in school, but maybe putting an extra advanced technique label to it.
Right.
Is that really doing anything extra, anything special? And if we look at the evidence, I would say no,
Hmm.
because when we are deciding to label a hands-on technique with a tissue label to it or descriptor to it, and we're not actually basing what's happening on the science of touch,
Right.
then that's not evidence-based from
Hmm.
from the evidence part.
Right.
And this is something that I've been hammering around for a long time, and I should probably let it go, but I won't. So too bad. The mechanisms of all of our touch are the same. Doesn't matter what you do, the mechanisms of touch, doesn't matter whether it's how you touch somebody, you're interacting primarily with the skin and the sensory receptors in the skin and the kind of reflexive effects of what happens with that without going into a big neurophysiology, neuroimmune kind of description. But when people teach courses, they attach a label to it. It's myofascial, it's craniosacral,
Right.
it's lymphatic, it's circulatory, it's whatever you want to call it. There's a million different names out there. And they all claim to be doing something different. They're interacting with a different tissue. But if we take a step back and think, well, how can we interact with only this tissue when we're actually interacting with the skin and all the tissues all at once? It's way bigger than just fascia. It's way bigger than
Yeah.
just bones and joints because you can't get to that tissue without going through the skin.
Hmm.
So why is there this massive fascination with all these different name techniques when the science of touch is very clear that they all do the same thing,
Right.
just a different way of interacting with the person?
Yeah.
Stories behind them, the narratives behind those techniques don't meet an evidential standard.
Hmm.
There's no evidence to support them.
Yeah. But they can create buy-in, I think, is what,
100%.
yeah, people find interesting. Because if we switched over to calling it light fingertip pressure, long shearing force, how much would you spend on that? To be like, oh, you just sort of hold and push? Okay, done. Like, um, yeah, so we have to be critical and think a little bit more about that kind of stuff, I think. And especially when we communicate that to patients, what we believe shows up as we're treating, and then they take that home. And is that an empowering thing for them to think, or is it actually going to create their reliance on you, or believe somehow that they are less capable or fragile in some way?
Yeah, that's such a great point, Nadine, is that the how we think impacts how we communicate, which impacts the information we provide to our patients, which impacts our expectations of outcomes. And a lot of times those narratives or beliefs, maybe they don't impact the person at all. Maybe there's no negative outcome. Maybe
Hmm.
it's like, whatever. I don't care if I'm what you're doing, just as long as it feels better.
Right.
And that is the counter argument, which I get often. By often, I mean pretty much every time I have this conversation with a group, is, well, who cares as long as people are feeling better? And I say, yes, the outcomes are what matters most. What's the most important thing from a massage therapy appointment? The outcome. People might not care how they get there. However, if we are going to look at this from a informed consent and ethical perspective, we shouldn't be telling things to our patients that we can't defend,
Yeah.
that are based on historical beliefs or based on, oh, I learned this in this weekend workshop and this is just what I've been told
Yeah.
and that's what I believe.
Yeah.
Was that good enough? Is that good enough for the public? Is that what is expected of a regulated healthcare profession? And I would
I would
say
hope not.
no,
Hmm.
but that's the way it often is.
Yeah. And I hope it shifts as we start talking. Another big word right now is trauma informed practice,
Yes.
right? And one, if you read through the literature on that, some people have experienced medical trauma in which medical professionals have lied to people about their bodies, misinformed them, left information out, these sorts of things. And I think we're doing exactly that every time we feed a patient pseudoscience. Like, it's not trauma informed to say, oh, you've got this pulse in your body that, oh, you didn't know about, but I do, and I can take care of it for you. That's a power over move. Um, and so I think that really needs to be considered carefully too.
That's such a great point. I love that. Would you call it a power move? A power
Like
over?
a power over, like I
Power
have
over
power.
move.
Yeah.
Yeah, yeah, yeah. That's brilliant. And it's true. That puts us as a clinician centered,
Hmm.
just the exact opposite of what it says here when we go back and look at the requirements for evidence-based practice standard is it should be patient centered.
Hmm.
If we are the one with the power, we're the ones that can feel and do these things to you.
Hmm.
That's not centered on the person on the table or the person in our treatment room.
Hmm.
I like what you said there too about the power over them and that us being able to feel and be the ones that are responsible. It makes it doesn't make sense to me in this kind of patient-centered, shared decision-making, biopsychosocial, evidence-based, all these buzzword things, right? We use all these words, and a lot of these the pseudoscience stuff will use those same words, but then it still puts the practitioner as the one in power, which is
Exactly.
totally contradictory to all those other kind of buzzwords we just mentioned.
Hmm.
And that's not in the person's best interest.
No, no. And it perpetuates, like, how many of us have had someone come in and say, oh, well, I feel out, like something's out, or like, oh, yeah, I just really need um, my energy realigned, or whatever it is. Um, and now they've got that belief about themselves and they are coming back constantly to get it treated. Um, and you're slowly trying to be like, encourage them to say, yeah, you maybe feel off, and I'm here to support you with that. But there's nothing wrong with you. You know, you're not out. What does
God,
that even mean?
yeah, that's such a weird term too, isn't it? Out. Out is a
Yeah,
feeling. It's a subjective thing. Like I feel like, and we've all heard our back or heard a
yeah,
rib or a neck, and you feel out, and it doesn't move the way you want it to, but it hasn't gone anywhere. But so it's
hmm,
often used as a descriptor, but it's used as a descriptor, I think, by patients so that a practitioner can then be the one to put it back where it belongs.
absolutely. Yeah,
And whereas that's not evidence based, but what is evidence based is to say, okay, you know what? You feel that way, like you said, you feel
hmm,
to support you. All we could really say is that I'm going to do some things massage, movement, maybe a little bit of joint mobilization, stuff within our scope of practice. And we'll see if that creates enough change for that to feel better. That's all we can really say,
hmm,
I think. I
yeah,
don't think we can't make these big claims
yeah,
because they're not evidence to support that. And a lot of people might be listening to this or they've heard me say this before and they feel like we're being dismissive. And again, neither you or I are claiming that things are ineffective or they're all BS. But we're saying the stories and beliefs definitely are often BS.
yeah,
And going back to what you said a few minutes ago about the trauma informed thing, which is another big term that's being used right now, and I feel that it's quite important, but I feel that a lot of us don't really understand what it is.
right.
You
Yeah,
know, I was very fortunate that a colleague shared a trauma-informed webinar with me, which I put up on my website. That was done by a psychologist with a specialty in trauma.
yeah. Speaking
That,
of qualified expert.
and kind of going back and thinking about it, this is somebody like you should be learning a trauma-informed course from somebody who is probably not just an RMT. I mean, you know what I mean? Like somebody that's an RMT that's maybe taken a couple courses on it. That's probably not enough to be properly trauma informed. But we should be learning from people that have expertise and extra training in a specific topic, particularly if it's something like that, where there is a
Mm,
lot of potential to re-traumatize people or to
yeah,
make them worse.
yeah, absolutely.
You also mentioned too, Nadine, about us re-traumatizing people and about the medical stories and stuff that we use. And this is something which I just wanted to come back to and emphasize again was that the power of our words and our narratives are very strong. And we often don't realize that. And when I'm teaching courses or speaking with groups, they don't realize that there could be a problem with that.
Mhm.
And it's not always a problem. But for those that it is a problem for, it can be a big problem. And the world that I came from, like before I started, or as I started getting into teaching and furthering my education, was chronic pain. And reading the chronic pain literature and spending time with people that lived with chronic pain, and realizing that a lot of their coping behaviors, if I want to use that term, but how they lived with their pain, which was oftentimes not very well. They struggled. A lot of times it was their beliefs and ideas about what was actually happening in their body that were put into them by well-meaning healthcare providers that were negatively impacting their quality of life. It was stopping them from doing things that were important and valuable to them. Oh yeah, I've got this pain in my leg. I've been told my nerve is damaged beyond repair, and so every time I move, I'm just going to just sever that nerve. That's a story I heard from somebody that had a disc injury and had permanent kind of sciatic type symptoms. So they didn't want to ever move. They never wanted to load their leg. They didn't want to do anything because they were worried every time they did that, it was just going to basically cut that nerve off and they would just be completely gone. Rather than saying, hey, you know what? You've got damage in your nerve. This might be something you have to manage for a very long time, the rest of your life. But you're not going to, based on the history and based on what you've been going through, is probably you're not going to make it worse beyond. It's not going to get significantly worse if you get up and move around and do life. Well, let's now move this discussion towards, maybe we can do a live critique of a course ad or of ideas rather than a specific course per se.
Mhm.
We can talk about some ideas because we haven't taken these courses, so we don't know exactly what it might look like. However,
Mhm.
a popular one, which we've seen that's shown up on social media, is spinning babies. Seems very
Mhm.
popular. You go to the website, it's a trademarked thing. And there's lots of stuff that just shows up right on the first page, which makes you think, is this real?
Yeah, because you Google it and the first thing you're going to see there is spinning babies, comfort in pregnancy, and easier birth. Like that's a big claim. Uh, I want to see some proof for that for sure.
100%. And I agree with you with that because that would be amazing. But if you're making
Yeah,
big claims, you have to be able to support that with evidence.
yeah.
And we can all use clinical experience to say, oh, yeah, why do this? And people have less complicated births, they have more comfortable births, less likely to have cesarean sections. But that's also, we have to be mindful that it's a very biased perspective. And
Hmm.
when I look at the Spinning Babies website, there's a lot of great stuff on here. Like it's a beautiful website. It's got a lot of great things. It talks a lot about, birth education and how it talks a lot about anti-racism and gender inclusivity. And there's a lot of, ways of like healthy living and information about pregnancy. So I think there's probably a lot of really great stuff on here just from looking at the
Right.
website that they include. But so this critique is not about the overall value in this group, this organization. But let's just talk specifically about, can you spin a baby with external techniques?
Right. Yeah. Or if
Has
I
that
was looking at this course, what am I looking for to see if I want to invest my time and energy and brain space into learning this?
Let's talk about that. So they have workshops. What is it? What are you learning in these workshops? What are they teaching you? They are oftentimes teaching you about someone you can spin a baby through positioning and external techniques. Is that something that, as massage therapists, is that within our scope of practice?
Yeah, that's a big question.
Right? Should we actually be? Can we be doing this to help? And is there evidence to support it?
Right.
looking at the website here, it looks like a lot of the stuff is geared towards nurses and doulas, and there's massage therapists that are doulas as well. And I think the more support we can give to somebody that's pregnant, or a mom during labor or just before she goes into labor, I think is there's a lot of value in that. But can you actually spin the baby, and should you spin the baby?
Right.
I don't know.
And should we be saying those sorts of things? I always think is like, should we be saying these kinds of things to a patient?
Yeah, because what's that? If you're like, oh yeah, I've been trained in this and this is what happens, and then what happens if the baby doesn't spin?
Right. Yeah.
And then they have to do a C-section. The thing is too that is we have to be mindful of, and I just know this because, from an outside observer and having two daughters, that oftentimes the babies will not be sitting properly
Mhm.
until just before birth,
Right.
where they will then get into the position that they need. And that happened with both my kids. So bias sample. I saw it
Hmm.
twice where they're like, "Oh, we're worried about this." Oh, and then
Yeah.
just within the last few days, baby spins and gets ready to enter the world. Let's be critical of that. If you're taking a course, you're talking about spinning babies, and you do, and the mom is concerned, the family's concerned that the baby is sitting improperly, and then they go through this whole process, and the baby then rotates, and then they have a natural birth. Is that because you did something to them, or is that just something that would
Right.
have happened regardless?
Right. Yeah. Yeah. It's that pushing on spleen 6 point, that acupressure point. It's like, did that help? Probably not.
Yeah,
Yeah.
but we are highly susceptible to these types of biases and these types of things. We kind of see what we want to see.
Yeah.
Yeah. So I don't know. Like I see these courses and I think, do you need to take this course to learn how to help somebody who is pregnant or going into labor? Are the claims that are being made in it supportable by science?
Hmm.
And you did a wonderful job. You found one paper, I think, that
Yeah.
that actually studied spinning babies and the method. And what did it find?
It seems to show that there may be slight um, reduction in likelihood of cesareans and I think it was a specific group of pregnant people, not all. Um, but the numbers were pretty close, and you brought up a good point that the sample sizes for the spinning babies group and the non-spinning babies group were actually very different.
Yeah, I believe there was twice as many non-spinning baby mothers, spinning
Hmm.
baby situations
Hmm.
versus, I think it was about 800 that were just went through natural and about 400 that just went through like a spinning babies thing. So obviously there's a huge variety or big difference in terms of they weren't equal. It wasn't like
Yeah.
400 and 400. So that can change the numbers.
Yeah.
Yeah.
Yeah. And because it was a review of literature too, it depends on the quality of what was studied as well. So we don't know for sure. And this particular paper right off the hop says, yeah, there's not any research evidence on this. And so they were trying to fill that gap. Um, so as it stands, I wouldn't say there's a really well supported base of evidence for that. And you head even into the Spinning Babies research and references page, and there's one, two, three, four. There's a pilot project. There's not a lot here.
Right. So you've got an entire registered trademark treatment that's based on 4 research papers and clinical experience.
Mhm.
Is that evidence-based? And so for listeners, anyone who's listening to this, knowing that, would you still consider investing money in something that's based on 4 papers and an idea that hasn't been supported? I think that's something that people really need to consider before doing things like this. And you could say that for a lot of other courses too. I mean, uh, there's a lot of other ones out there too, which will make big claims, but then if you look at their research evidence, a lot of the times they'll just blast. Maybe they'll have hundreds of research papers on there. If you look at their website, and they'll have like all this research evidence on there. But is that evidence consistent with what they're saying in their courses, or is it
Right.
just kind of sound similar?
Yeah. And maybe something to discuss too is like, okay, so you look at this and the research isn't very strong, but something in you is like, well, I'm going to take it anyway. I might consider being really clear on what you're going to get out of it. And yeah, what you might want to consider is if I take it, what am I looking for? Is it actually just maybe getting better at working with pregnant people? Is it learning some techniques and positioning that feel good for that population rather than, oh, I'm going to get this very specific skill?
That's fantastic, because this is a question I get often too from people, is that, well, if I'm, I'm aware of the limitations of all these different named modalities and stuff, but I just really don't feel like, I'm not really sure, like I don't feel comfortable working with the jaw or the head, or I'm not really comfortable working, I don't really know how to, maybe I want to work with more positionings for helping people with the abdomen or the low back or the pelvis. And I would say, yeah, you can take this stuff. Like, I'm not critiquing that you shouldn't take these things, because maybe it's a population that you're interested in. Maybe it's an area that you're interested in, that you just don't, you want to learn more ways of putting your hands on people or interacting with people, or maybe more understanding about what's happening with that particular population. I think that's great. But
Mhm.
please, if we're going to be based on what we know, and based on the requirements from the CMTBC, and should be the requirements of all healthcare professionals, is be skeptical of the claims that they're making in those courses.
Yeah.
And I've had people that have taken stuff from me, and they are totally aware of the the greater amount of evidence out there in touch. But they're like, I really want to I want to learn some nice positioning and soft touch type things, and I'm just not really sure. And they'll go and take like a craniosacral course,
Mhm.
or they'll go take like a visceral course just so they can. But they're just like, I just wanted to learn how to treat this area differently. But I'm gonna just say, forget all that nonsense. And I'd say
Mhm.
that's fine. I know for me, a lot of the stuff that I've did in my early career was all like myofascial stuff. Like I did all like the structural integration and fascia things, and I still use a ton of that stuff. Like the technique, I love, because it's like slow sinking in, connecting with somebody, getting them
Mhm.
to feel safe, putting them in some different positions, which I didn't learn in massage school. It's fantastic.
Yeah.
But there's no way that I'm telling them I'm releasing fascia, because there's no evidence to say that. And people are like,
Yeah.
yes, there is. No, there isn't. Show me.
Yeah.
Show
Yeah.
me. Yeah, it doesn't
Yeah.
exist.
Yeah. And that I think there was some discussions recently too about shiatsu too. And I have a background in shiatsu and it feels great. I learned, different positions, different ways of applying pressure, and they're awesome. Um, I've brought that with me and left all of the other organ diagnosis and meridian stuff behind. Um, I don't think there's anything wrong with that. So,
That's fantastic. And you do that, you
yeah.
still use those techniques and those approaches and
Oh, absolutely. I wouldn't be able to help myself. Like it's just so ingrained in what I do. So,
100%.
yeah.
Yeah, that's awesome. And that's the key thing I want us, or one of the key points I'd like listeners to this episode and any other episodes too, then we are kind of critiquing things, is that, the clinical practice doesn't necessarily have to change, but the claims and the beliefs
Yes.
need to be evidence-based. And if
Yeah.
you are going to learn something that is beyond just normal massage techniques, so you're going to learn maybe something more population specific, make sure that you do your due diligence to assess the evidence that's being used, and maybe ask the instructor, what's your experience? Like, why should I learn from you versus from somebody else?
Yeah.
And I would say that most instructors should be able to, well, all instructors should be able to answer that,
Yeah.
and be able to say, yeah, because of This is why, and this is what we teach, and this is the framework or the base of the evidence that we come from for this course.
Yeah, and I would encourage people to armor themselves before even that conversation and have a little look at the evidence. What is sort of our understanding of this area or whatever currently? And then compare that when that information comes from the instructor and say, okay, is this jiving with sort of the body of knowledge that's out there?
And it's a big thing too that we just don't have this in our curriculum.
Hmm.
There is a research course, but when I talk to new grads or students still, I'm very fortunate I get these opportunities to see kind of what's going on, what's happening in schools these days. There very few of them actually do like a proper research course that is actually good quality.
Right,
They oftentimes it's just like find some papers and tell us about them without actually
right.
doing a proper critique, and it's just not part of our curriculum. And I really wish it should be. And this maybe that's time for another discussion about the benefits of us being in a university somewhere where we would have more
Hmm.
instructors and exposure to that, because most RMTs don't have that education or that experience, and so therefore if you don't have that and you can't teach it. Like
Right.
you can't have an RMT teaching about research evidence if they don't have any experience or education on that.
Yeah.
So
Yeah.
that's a big thing. So when we look at stuff, so moving on to the next thing we want to talk about here about the resources page. So the CMTBC, and this is open to everybody. So if you're listening to this, doesn't matter where in the world you are, you can access this. Is on the website. It's on the CMTBC.ca website, which is going to be gone soon, and it's going to be moved to a new website, which I can't remember the name, but it's the College of Complementary Health Professionals or something.
Yeah. See, there's a lot. CCP. There's a lot of letters.
A lot of letters in there. So
Yeah.
it'll be the same information will be here, but it'll be based on a new website. So if you're listening to this and you can't find it in the CMTBCA website, I think it should probably hopefully auto direct you to the new website.
Yeah. They'll
Hoping so.
probably set that up.
Hoping so.
Yeah.
That's what they'll do. But we don't know yet because as we're recording, we don't know. However, on the CMTBC's website, public access, under their standards of practice, they have an evidence-based practice thing. It actually goes through a whole fantastic section here on research evidence. What is it? Locating it, critiquing it or evaluating it, and different questions to ask. Biases are all there. It's got a whole bunch of, I think, is actually really good quality resources
Hmm.
for RMTs or anybody in the public to look at.
Yeah.
And it's got some great examples too about, I believe, on evaluating sources, and maybe we can discuss that in a moment. There's a great course on there called Viscerokinetics, which is a made-up course, which I think is hilarious. So, why don't you talk for a moment here, Nadine, about kind of the things under the locating research and talk about some of these.
Yeah. Sort of in the top part before you get down to the course, they've got just a ton of links on like where to go and look to start. And then I really love that they included in the evaluation piece some well-established frameworks for what questions do I ask when I'm looking at something. So maybe you've listened to this podcast, but you don't remember what we talked about. Right here, there's the 5W, there's SIFT, and it just will walk you through, here's some really key things to look for. And then they even provide more resources if that's not enough. So like this is actually a really great guide. And I also like even defining bias, because maybe that's something a lot of us haven't even thought about in research and in our thinking.
Bias is
So
huge, and that's
yeah,
that we everyone needs to admit that we're all biased. I'm biased. You're
absolutely.
biased. Everyone's biased. And if we're thinking of like a critical thinking perspective, right? We're always thinking and being critical of our thinking and how we're thinking. Right. That's kind of one of the main frameworks of that. So if you acknowledge your bias and say, hey, I have biases. This is where I'm coming from. This is what I think, and this is why I think this way, then it allows you, I feel, to critique and be mindful of other information, knowing that you are coming from a specific mindset or specific thinking framework. And that is
Yeah.
oftentimes how you're going to approach new information. If we don't recognize our biases, then I think it opens us up to basically linear thinking,
Yeah.
because we're just constantly looking for that confirmation bias. I want to see the things that I want to see. I want to find
Yeah.
the support.
Yeah.
And this is a question that we see all the time, don't we, online? And we see people, I'm looking for research papers to support whatever, insert
Yeah.
blank here. Is that really what you should be looking for? Should we be looking for something to
Mm.
confirm what you want to find? Because you can find that.
Yeah. Absolutely.
You know, you can find a single study that'll basically support any bias.
Yeah.
And that's not critical thinking. That's not evidence-based.
Yeah. Yeah. And a technique I use, and I have to catch myself. It really is. You do have to catch yourself and go, oh, I'm really excited about something. Notice when you're like, oh, this is really good and I bet it'll make a big difference. I take whatever that phrase is and in Google, I'll type in that thing. And then after it, I write debunked.
I
And
love
I look for all the contradictory stuff or people saying, this part doesn't seem right. Or like, there's some evidence against this bit or whatever, to give myself a much more rounded view of something. And kind of calling myself out on my bias.
Yeah. I
Yeah.
love that.
Yeah.
Really important. And, you know, choosing learning activities is kind of one of the focuses of this conversation, and using
Mhm.
resources. You know, you should be able to try to challenge yourself and not just chase the current fad. If we wanted to go down that road of challenging polyvagal theory,
Mhm.
just very another popular one, and we wanted to evaluate the source, you know, using some of these ideas that are listed on the CMTB's website. And, you know, we could say, well, you know, these questions: who is the author? What is the purpose? When
Mhm.
was the item written or published? Where is the content from? Why was the research written? Right? We get ask these questions. The sift, stop, pause to think about the information critically, investigate the source, find better coverage. Is there alternative resources that cover the same area to see if there is a consensus? Trace
Mhm.
claims, quotes, and media to the original context. Claims are cited, look into the original source and repeat the SIFT process. Now, radar, the other one they talk about on here. Relevance, how is the information relevant to your project? Authority, who created the resource and how credible are they? Date, when was the information published? Is it still accurate, relevant today? Appearance, does the resource look clean and professional? Is the language formal and academic? And reason for writing, why was the resource created? Was it to sell or promote something? These things here, we could, so just using polyvagal, because that's another one of the ones that's out there. Who's the person that's writing that? Who's the one that's published all the research on that?
Yeah.
It's the same guy.
The same one guy. Yeah.
Same one person. So it has, and then you're like, okay, well, has anyone else written about it other than him? And I believe, I could be totally wrong, but I believe that there's other people out there that have looked at it and they've like, no,
Mhm.
it doesn't, whatever you're saying doesn't fit
Yeah.
with what you're saying. So there's contradiction to it. And
Yeah.
when you're looking at the claim, so using these 5 Ws to sift these radar ideas, you can kind of say, okay, well, this is all created by one person who's claiming all this research, but it's based on an idea that's got no science to
Mhm.
support it. And there's actually stuff that contradicts these claims done by the researchers.
Yeah. And why is it being carried forward? Oh, there's a whole bunch of courses for sale. Oh, there's books for sale. Oh, okay. And then you go, and I've seen some interesting discussions of people starting to wise up to that and being like, wait, is there anything to this? Okay, well, what if there's nothing to it? What is still valuable? And I'm not sure that for our scope of practice that it's super valuable, but say for people in the mental health field, does it help them communicate about something in a more simplified way? Is there a benefit that way? But I wonder if there's just a better, more honest, in keeping with being honest with people about what we know about our bodies. Is there a more honest research-based way to communicate with people about that.
There probably is.
Yeah.
There probably is. It's a great I know it's kind of a rhetorical question, but can we impact, like we talk a lot, the kind of the new buzzword is nervous system, and I would admit that I'm probably one of the people I've been definitely used nervous system probably a lot more than I should have. But,
Right,
it helped me move away from connective tissue
right.
explanations to more of a nervous system explanation. Now it's more of kind of like, I think of it more of like a system that we're interacting with rather than just a specific tissue or tissues.
Mhm.
Just the evolution of our thinking, right? As time moves on. See people talk all the time too about the vagus nerve. Can we actually do anything with the vagus nerve? Can we impact it with our touch? It's nervous system, so a lot of people think, yeah, we're impacting the nervous system, so therefore, I can impact the nervous system by working with the vagus nerve. And can you?
Well, it looks like in very specific cases in, is it seizure or something, but in a very medical place, and it's not a nice massage touch. Like it's a medical procedure, and like apparently you can directly affect it, but it's that has nothing to do with us.
Yeah, and that's the thing, is that can you maybe create some type of, we know the vagus nerve is responsible for a whole bunch of stuff in the body.
Yeah,
I can't remember off the top of my head what they all are, but there's a lot of stuff it does. Does massage have some type of, impact on that? Maybe, but we can't say for sure that
yeah,
because it's not going to be just the vagus nerve.
yeah. Well, and I think that's the point. The point is we love things to be one thing.
Yeah.
Oh, it's fascia. Oh, it's lymph. Oh, it's the vagus nerve. Yeah, so we're complex animals, complex beings, and we can't reduce us to just one tissue or one nerve or, you know, one process in any way. Everything is deeply connected. Um, so again, I think we do a disservice to people by trying to just be like, oh, it's this one thing.
100% agree with you, and it's important for us to acknowledge that when we're working with people, we're working within a human, within a whole bunch of different systems that are integrated, all working together. And to say like, oh, I'm going to take this polyvagal course or this vagus nerve course, rather than just talking about that specific thing, why don't you have a course on like stress? Like this is we're going to teach you a course on how to help with stress, and in this course, we're going to learn about the fight, flight, freeze reactions. We're going to talk about how social engagement and the clinical environment can help to regulate or change or influence our systems. Why don't we talk about courses? We'll do some touch. We'll do some visualization. We'll do some movement, some exercises. Help to calm a sensitized system or whatever it is you want to use, whatever kind of terms you want to use.
Right.
That I think is a less wrong approach
Hmm.
where you're probably still doing a lot of the same thing, but you're not just focusing on the work of one guy and his one theory.
Yeah.
And
Yeah.
polyvagal it should be polyvagal hypothesis
Yeah.
because a theory means it's based on known science, whereas
And
hypothesis,
it's pretty well established. A theory is
yeah,
well established. Yeah.
yeah, and polyvagal so it's not really a theory. So that right there too is a bit of a
Marketing ploy.
marketing ploy and a bit of a red
Yeah.
flag. So
Yeah.
if we went and looked through all the different learning activities that were out there for massage therapists across North America. A lot of it, yeah, is kind of a lot of it is, like I said before at the beginning of this podcast, a lot of it's based on pseudoscience.
Hmm.
But there is the possibility for most of these courses that we could tweak them and turn them into something that was evidence based if you just kind of brought in some of the science to help to explain and inform what's going on in those courses.
Absolutely.
And so I think we can do better. We need to do better.
Yeah. Yeah. I'd like to see people commit to taking what works, whatever touch, whatever techniques, and doing the work to say, okay, well, What do we actually know?
That would be better for the profession.
Yeah.
That would be better for the public, which is really the ultimate goal, because we're taking these courses so we can learn how to help people.
Yeah.
And it's probably, I'm sure there's people listening. Maybe not. I don't know. Maybe people in pseudoscience don't listen to my podcast. But there's people that are listening that are probably really upset by that. But I would just say, if you feel defensive or you feel upset by these things, no one is attacking your clinical practice. No one is attacking what you do. But we are going to challenge the ideas behind why you think things are working.
Yeah.
Because that needs to be based on evidence.
Yeah.
And if you're in
And why not take a risk on being better?
Yeah. And if you're in BC and it's part of your learning plan, make sure that you're choosing instructors and courses that are consistent with that evidence-based practice standard, because it's actually something we're supposed to be doing. And if you haven't, visit the CMTBC's resource page, because there is a ton of stuff on here. And it actually gives you these different case scenarios, like I said before, about somebody who wants to learn a course called visceral kinetics. How they're evaluating the sources from an unregulated health practitioner with no noted certifications or licenses. There's a lot of claims in here that the person finds, and then they decide, you follow the story, they decide that they're going to keep searching for something else because this doesn't meet the standard.
Yeah.
If you're listening to this, please follow these steps to choose stuff that works for you. There's a lot of good stuff out there. We are kind of throwing some of these popular ones under the bus, but there's a lot of good stuff out there. And particularly if you use these standards and you think about your thinking, you will find that a lot of stuff that you might think is evidence-based actually isn't.
Yeah. Sad but true.
We need to do better.
Yeah.
That's really what it comes
Absolutely.
down to.
Yeah. And it really is, I think you spoke to that, and it's not a personal attack, but we really have to think about our patients and our society and what information we're spreading out there and what impact it could have. And that's the doing better. It's not just making one individual therapist's life more difficult or challenging them in some way. It's about our patients and our society for me.
100%. I agree with you there too,
Yeah.
Nadine. That's such a great point. And just to kind of finish this off here, to build on that as a profession, massage therapist, and whether you're in a regulated or unregulated province in Canada, or whether you're overseas or you're in the United States, the goal is always to elevate the profession to the level that it should be and could be. I often like to, when I'm talking to people, I always like to say, well, my whole goal is to try and put massage therapy to be what it could be, not what it currently is. To
Mm-hmm.
raise our standard. And that starts with the education we have. That starts with the courses we take. It starts with the communication we use, the words we use, the explanations, the narratives. More so than the actual hands-on, it's the bigger ideas behind that inform our hands-on. And if we want to be sitting at the table with physiotherapists and occupational therapists and medical practitioners, if we want to be in these allied health camps, which a lot of people do in our profession, they
Yeah.
feel like, oh, we're the inferior, we're the bottom, and I think we don't have to be.
Mm-hmm.
But until we change these ideas, and until we challenge the pseudoscience that just permeates through our profession, we will not reach those other levels.
Yeah.
We'll consistently stay down kind of with this imposter syndrome. We're not good enough. We're not smart enough. Nobody respects us.
Right.
We have to earn that respect. And by doing that, we need to jump into the evidence deep end.
Yeah.
Fully immerse
Yeah.
yourself in there.
Yeah.
And then we'll start to see these bigger systemic changes. I strongly believe that is possible.
Mm-hmm. Yeah. Yeah. And that comes through committing to a lot of the stuff that you've got in your courses too, of like, what do we actually do, and capitalizing on those things and making that better.
100%. Yeah. What do we do and how do we do it better?
Mm-hmm.
Whether that's our language, our assessments, our treatments, our self-management or home care. How do we make that evidence-based? And how do we do that in a way that's consistent with what we know? We start doing that, profession will reach a higher level. I'm certain of that. And we do start to see it a little bit in some of the grads are coming out from certain in schools that are doing a really good job. You start to see this like higher level of understanding because they've been exposed to it and they're open to change and to challenging the status quo.
Yeah.
So more of that is needed, and hopefully, but before you and I leave this planet, we'll we'll see some bigger changes throughout the profession.
Yeah, agreed.
Okay, we'll leave it at that. Nadine, thank you very much for being here again today. That was an amazing conversation. I really enjoyed that, and I'm sure we'll have another one in the future.
Awesome. I look forward to it.
Thanks. Thanks again for listening. I appreciate all of you for taking the time to be here. If you enjoyed this episode, please give it a 5-star rating and share it on your favorite social media platforms. You can follow me on Instagram or Facebook at ericpurvisRMT, and please head over to my website, ericpurvis.com, to see a full listing of all my live courses, webinars, and self-directed course options. Until next time, take care.